In other words, the statistics include patient portal use before the pandemic and before the final rule implementing key patient access provisions of the 21st Century Cures. So many patients have clearly delayed the hunger for their health information. The 4 in 10 individuals who access the patient portal in 2020 represent a 13 percentage point increase from 2014. I want to say the portal is dead, long live the portal, because we see digital front doors is now the new terminology, and we see people really heading down that path. What do you think portal usage uptick is due to, and what is the future of the patient portal? I didn't give you any of these questions ahead of time, so these are on the fly. This is Dr. Collier, right on the fly, coming off vacation, answering these questions.
Yeah, so I'll answer your last question first. So what do I think the future looks like in terms of patient portal? I do think digital front door is catching on, and for good reason. And that's if you provide a platform that does more than just serve up maybe lab results, that provides the ability to have meaningful interaction with your patient, it's great for the patients and it's great for the health system. That's how you can drive patient engagement. That's how you can drive patient satisfaction, patient interaction. But you have to have not just a massive library of point apps, if that makes sense, niche solutions that you can app your patients to death if they're not a single platform that brings it all together. But the more features and functionality you can provide in that digital front door, the more access you can give patients to what they want or what they need to do to interact with the health system, the more powerful that's going to be. It's the same kind of omnichannel strategy that we see every other industry has had and has been building on over the past 2 years throughout the pandemic. Any other big brand that we interact with, we've got one place to go. You can do it on the web, you can do it on your phone, you can do it from whichever device, but it's one app where you can do everything that you need to do to interact with that brand. Your bank doesn't have a bunch of different apps, right? Your bank has one app. Your airline, back when we used to travel a lot, you didn't have to go a bunch of different apps to do everything you needed to do to interact with Southwest or Delta or any of the others. Yet all those platforms are a platform that has a bunch of different features. And of course, Amazon's a great example of that too, right? You can get to Prime Music, you can get to Prime Video, you can shop, you can order your groceries, like all of those things, all from a one-stop shop. And healthcare is just catching up to that trend, but it's the right trend. And it's the right value to deliver to your patients, right? Give them their education, give them their place to jump to a telehealth visit, give them their place to store their information, to provide information to the health system, to get information from the health system, to schedule an appointment, to do all the things they need to do to interact with the health system.